GPs in England are at breaking point amid collapse in morale. We're going to read into this more from Byline Times, you guys. Let's go. Good morning, good afternoon, good evening, wherever you are in the world. This is Reganelite here with an article from Byline Times with the headline that GPs in England are at breaking point amid collapse in morale. A significant number of GPs are leaving permanent positions for locum roles and leaving clinical careers altogether, according to a new research by EveryDoctor. Guys, while you're here, make sure you hit the like button and share across social media so other people are notified of this video. So for those who don't know, EveryDoctor is a campaign that's they are actually a very good group. I have some very good people who work in there that I've heard some of their stories and videos shared online on social media around. So they are one of the good ones, I will say, when it comes to things about what's actually happening within the NHS. This headline about GPs in England at breaking point is so demoralising when you think about how things was 14 years ago, before the Conservatives took over, before there was a coalition government, when Labour were in power. The National Healthcare Service in England, overall in the UK, was one of the best healthcare services in the world. That's just not an opinion, that's actually facts. And if you don't believe me, feel free to go and Google that yourself, that the information is out there. We have one of the best healthcare systems on the planet. And while it doesn't always work with every single country, every healthcare system is different for every single nation, it was one that always worked for us. And it is one that has worked for us for so long. And the NHS has changed so much since then, in that 14 years, because the Conservatives want us to go down a path that America has gone down, and that is, you pay your taxes and the government pays for a healthcare system, but you still have to pay for the healthcare that you have in America. Which means if you got cancer, that means your life savings goes. That means if you need to see a doctor, you've got to pay to go in to see that. Simple, basic necessity means you've got to pay for in America. And my heart bleeds for people in America who actually have to go through that. It really does for me, because healthcare should not be something that should be something that you have to pay for. It should be always there for you. It's supposed to be there for you. It's supposed to be something that is a necessity for people. And GPs in England, where is the incentives for people to stay within GPs general practice in England, when they are so overwhelmed and not getting anywhere near enough the pay that they deserve? They end up going to places like Australia, when Australia are offering them a lot of money. Why shouldn't they go to Australia when they can get less stress, work a bit less, and get paid a bit more? Anyone that ever tells you there's an opportunity to work less and pay more, you're going to snatch your hands off and you're going to take it. There's a lot of people, I would say, those GPs who are still in England are doing it not so much out of necessity for the money, but doing it out of necessity for their love for their job, for how much they care about their job. But more and more people are leaving the profession, and we train up a lot of people in the NHS, in our National Healthcare Service, to become doctors and nurses and whatnot. And then after they're done, some of them just bugger off back to their own country. It doesn't feel right. I think it's a broken system the way it works. But a question I have is, what is Wes Streeting, who is the shadow health minister, who will potentially become the health secretary under a Labour government if they win? What's he going to do about this, apart from prioritise bloody everything? Because he's someone that I don't trust in any way, shape or form of our healthcare system. It's infuriating, because we already have, I think it's Victoria Atkins, who's the health secretary, absolutely clueless, they won't even sit down and discuss pay terms and conditions with doctors and nurses in our NHS England. And people wonder why there's strikes taking place. Well, it's because they haven't had a real time's pay for a long bloody time as well. Anyway, let's read into it, guys. So primary care and doctors in England are feeling despondent and feel unable to provide adequate care to given the current pressures on workload and funding, Byline Times has been told. GPs and emergency doctors are picking up the pieces amid long waits for operations, as well as crisis of mental health underfunding, according to testimony shared with this newspaper. So I've talked about, I had done a video not too long ago about the NHS mental health care and how underfunded that is. Now, Labour have said they are going to they have some plans for mental health within the healthcare section, which I have read into, so there is some positive there if Labour come into power, which I will say. And a significant number of GPs are leaving predominant positions for locum roles, filling in for those ill or on leave, or leaving clinical careers altogether and unsustainable workloads and heavy admin burdens. Dr. Kath Fielder, a GP in the North East, told an EveryDoctor survey for Byline Times, "Everyone I know who is a GP is very tired, despondent and wavy. I actually think that the predominant emotions is sadness. Nothing works like it should, and it's truly heartbreaking seeing patients receive substandard care from the entire NHS. We in primary care become a holiday bay for people waiting years instead of months for urgent procedures, managing people with significant mental health problems because they aren't bad enough to reach the threshold for massively underfunding CAMHS, that's Child and Adolescent Mental Health Service. Writing appeals for PIP, personal independent payment, because so many people are losing their benefits." She compared the situation to handling someone of a thimbleful of water when their house is on fire. "I rarely send patients to the hospital, but when I do, I'm truly shocked at how many are sent straight home again," she added. And this is not a criticism of the hospital staff. I know they will be incredibly pressured not to admit anyone that there won't be any beds for them to lie in. While this is happening, we are increasingly restrictions in what we can prescribe. We can refer and impossible targets to attain. Some GPs are now unable to work given the conditions, and many more are swapping permanent posts for temporary or ad hoc work. Asked what the biggest challenge is for her practice right now, she added, "Not being able to give care that we want, it's that simple." Dr. Nicholas Stower, a GP based in South West, said GP practices have increasingly been an incentive to hire less qualified associate physicians or advanced nurse practitioners, that's ANPs, over GPs as they were cheaper to employ. It comes as the new British Medical Association survey of 18,000 doctors found that 55% of respondents said the employment of PAs, that's physical associations, and AAs, anaesthesia associates, and their workplace had increased their workloads rather than reduced them. Just 21% of doctors responding to the survey said the presence of the staff have reduced their workload. Along with complaints over increased workload, the BMA survey also highlights serious concerns the use of PAs and AAs regarding patient safety. Among doctors working in primary care, typical GPs and A&E doctors, 90% told the BMA that the way the PAs were being employed by the NHS were a risk to patient safety, with 82% believing PAs frequently or oftenly work beyond their capabilities. Dr. Salner pointed to a recent case of two ANPs analysed a patient's blood, which they said showed a bit of toxic substances. One told the elderly patient that her life was under threat and she must go to hospital. Dr. Salner said, "I looked at our bloods and noticed that this lady had chronic kidney disease. Her blood toxin levels were always that high. In fact, they were unusually high. She did not have any acute renal failure." So this ANP to ANP discussion was all a misunderstanding. The advanced nurse practitioner was reviewing blood taken by another ANP, and neither knew the difference between chronic renal failure and acute renal failure. The poor woman was stressed, her family was stressed, an unnecessary ambulance had been sent, and our OOH physician had been kept busy. The GP said practices should never be allowed to have less trained ANPs outnumbering GPs, but of course while the government is underfunding GP practices, there is no way to resolve this. However, one GP said that the recruitment of physician associations, which ramped up following the 2019 government contracts with GPs, following years of practice struggling to recruit salaried doctors. Another added the GP's contract had generally speaking buggered up our practice as the funding not matched the demand. That said, so many factors are making GPs a nightmare to work in and manage that pulling out one strand is very difficult. PAs in this survey are very hit and miss. We have had two that have been utterly disastrous, making more work by wanting constant interventions on the part of their supervisors for the days, having a long list of things they won't do and referring to all kinds of things that they don't need referring. We were, however, had one of those absolute legends who had been a pleasure to work with. We wouldn't lose her for the world. The problem is that you don't know what kind of person you're going to get. 6 other GPs who spoke to EveryDoctor, who wished to remain anonymous to speak more freely, echoed their concerns, noting GP practices are struggling to recruit salarised doctors, leading many trainees to choose locum positions for better work-life balance. This has left full-time partners working extensive hours and additional unpaid admin work. Unpaid admin work. Unpaid. GPs also pointed to 2019 government contracts with GPs, which they claim have not matched funding with demand. Several GPs said the current workloads were destroying morale. On top of my daily appointments, home visits, supervisions, quick reviews, and prescribing for the team, I regularly have to check 5 to 8 sick notes required to action, 50 test results, and 20 to 30 letters to look at. District nurses tend to send me messages multiple times a day too. There has been a huge exodus of GPs in our area, so anyone I'm working with is unusually newly qualified. They can't seem to work at pace. Having been trained in the pandemic, I'm frequently having to mop up when too exhausted or upset over vexatious complaints. One of the biggest challenges is retaining GPs because of the above. One has just resigned and one is going abroad. Morale is terrible. I'm lucky that I have been in this practice for nearly 10 years, so most patients are appreciative. But the general public view is that we're rubbish, at the same time want us to do everything, fix everything, and do everything secondary specialist care. Yeah. People are blaming the NHS when they don't realise that it's the government that have put the NHS in this place. People don't realise that. People don't look and don't realise that they don't pay attention to what's happening around them. In another practice, a doctor described how we've seen a large rise in turnover of GPs. We've managed to recruit several GPs to replace them, but we're not in full capacity because we cannot afford to recruit as many as we need. The new GPs are very recently qualified and do need peer support. And they claim the recent 6% pay rise for NHS staff in England is not fully funded by the NHS. It does not cover our costs by a long way. Someone at NHS England decided staff costs are about 40% of income. It's more than 60 to 70% as a result. You are left with a huge dilemma. Our hard-working staff deserves a pay rise, but we cannot afford it without losing staff to pay for it. A&E specialist doctors, Dr. Hugh Evans, based in the West Midlands, said workloads in the NHS hospital meant care expectations had fallen through the floor. His department is consistently understaffed with significant vacancies among specialists, he said. The failure to invent an infrastructure after years of austerity is also visible, with Dr. Evans noting there are numerous buckets under holes in the roof of the hospitals. Yeah, we know about some of the hospital buildings are in an absolute state, and there's no funding for them whatsoever to fix them. Government won't provide it. Patients are missing out on professional relationships that used to be commonplace in the community. As a result, they come to emergency departments we never close, where problems could be dealt with in a few minutes that may take hours to sort out. The breakdown in primary care, including huge delays to get GP appointments, in turn slows down for care who really needs emergency help, he said. The sight of queued ambulances is the most visible aspect of this. We're not able to offer the level of care that we could wish we could have given up on gold standard aspirations. It used to be that a 4-hour breach would cause cancellation. Now, any patient who is not a 12-hour breach is a cause for celebration. I have worked with the NHS for over 30 years. The NHS is sinking like the Titanic, hulled by the iceberg of underinvestment. Captain Sunak is putting his telescope into his blind eye, telling us he only sees water clear ahead. Dr. Julian Grace Patterson, EveryDoctor Chief Executive, told Byline Times that the government's political actions has decimated the NHS. NHS GPs are absorbing an enormous amount of pressure currently, she said. They are doing everything they can to keep patients safe, but this is becoming more and more challenging as the situation evolves. The government is not supporting the current GP workforce. They are often scapegoating for problems that they have not caused, and there is now a move to flood the NHS with more non-doctor clinical decision makers, which is exacerbating the situation. Every healthcare professional has a role, and within the fully functioning NHS with abundant resources and physicians associated would be a welcome addition to clinical terms. We definitely hear about some places in the NHS where they are highly valued. However, many in the NHS, the burden of responsibility for supervision of their work fails with these doctors. This is usually labour intensive and even dangerous given the pressure on the NHS, the rate at which the staff must work and the potential for diagnosis to be missed and patient safety to be caused. Morale among GPs is very low and the situation must be urgently tackled. The government must listen to frontline GPs and healthcare leaders to rectify the situation. Politicians are profoundly failing NHS staff and the patients are devolved to caring for. Commenting on concerns on the rollout of physician associations, the Department of Health and Social Care spokesperson has said the role of physicians associates is to support doctors, not replacement, and they make a significant contribution to the NHS. PA works alongside doctors providing medical care as an integral part of the multidisciplinary team. They carry out clinical duties such as taking medical histories, carrying out physical examinations, and developing and delivering treatment and management plans. Regulation of these roles has cross-party support and will boost patient safety, with the General Medical Council operating strict fitness to practice procedures and setting out education and training standards. The government's long-term workforce plan aims to increase the physician association workforce in England to 10,000 by 2036 and to 2037. There are similar and associate workforce to 2,000 over that same period. Officials say the new regulations will give the General Medical Council responsibility and oversight of doctors, PAs and AAs to allow it to take a holistic approach to the education, training and standard to these roles. The testimonies from GPs and patients were gathered by EveryDoctor. Dr. Julian Grace Patterson is someone I follow and keep an eye on Twitter. She always is one very insightful person on all of this. She's covered on numerous times. If you can follow her, if you have Twitter or X as it's called, please go out of your way to follow her because she always has very useful information when it comes to what's happening within the National Healthcare Service. It's incredibly devastating and it's heartbreaking as well because this is something that we deeply care about. We, the British public, England, we care about our NHS. But people really don't realise just how lucky we are to have such a healthcare system. I think people really don't understand how lucky they are. I know it's really overwhelmed right now. But that is not... But this is what happens when you don't have a plan, you don't have funding, and you don't give the doctors and the staff and the training the necessary needs to ensure that a working, functioning NHS. The priority will be for when Labour come in will be to clear this backlog and to clear these operations, to clear those, to reduce these numbers significantly. And I believe they will do that, but it will come at the expense, as Wes Streeton has already said, about bringing in more privatisation, which is what we don't want. We don't want to go down that path, but we are slowly creeping towards it, and I don't like that in any way, shape or form. Where is the incentive for people who want to become doctors or nurses? You know, when you hear and read stories like these, the pressures that they are facing. You know, imagine taking, you know, if I'm imagining young kids who think about becoming a doctor or a nurse, being in an NHS, being in that situation and seeing these people run off their feet, the hospitals outside, the ambulances full of patients outside, that will put them off. And their parents will make sure they get put off as well. You're going to detract children from wanting to become doctors and nurses, this image as well. So what do you guys make of it? GPs in England are at breaking point. What more can be done? What should Labour do? Let me know what you guys think about this article and the future of the National Healthcare Service in England in the comments section down below. If you found this article interesting, please hit the like button, we'd greatly appreciate it. Share it across social media so others are aware of it. And hit the bell notification icon so you'll be notified when I upload another video. And if you want to financially support me and the work I do here, you can do so by becoming a YouTube member for as little as 99p or joining me on Patreon or Rumble for exclusive content. Thanks so much for watching, and I hope to catch you all very, very soon.